Great. Yes, we're one.
We'd like to welcome everyone who is joining us right now. We have started this special UN side event. And at the top of the hour, we will launch our event. So for everyone who is joining now, welcome and thank you for coming to join us today. For those of you who are joining, we would welcome you to introduce yourself in the chat. Please, there we go, great. Please put yourself, let us know where you're coming from, your name, and we'd be happy to see you there. So thank you. Wonderful. And we are at the top of the hour, and it is my pleasure to begin this special side event that Core Group is sponsoring as part of UN Week.
Sorry,
yes.
Maybe one more minute, just because we only have 13 people in. So maybe just one more minute, maybe give everybody. Thank you.
For those of you joining, welcome. Please do introduce yourself in the chat. And let us know where you're coming from. We have a wonderful special side event planned for you today, and our panelists will be engaging with you throughout. Great. Well, good morning, everyone. It's a pleasure to welcome you this morning, this afternoon, this evening. We're coming to you from New York and around the world. My name is Julie Dargis, and I will be your co-moderator today with Kate Kabori, the Global Health Fellow of Core Group. I would like to offer you all a warm welcome to this special UNGA 78 online learning event sponsored by Core Group. Core Group is a uniquely placed consortium of over 200 global health partners that convenes practitioners and public health professionals from around the world to share knowledge, evidence, and best practices at both the community level and on the global stage. Today, we will bring you this special event from New York City and around the world to highlight the work of Core Group members who are addressing the challenges of climate through innovative approaches at the nexus of climate and global health. To begin, it's my pleasure to introduce you to the Executive Director of Core Group, Lisa Hilme, who will officially open the webinar and provide us with some opening comments. Lisa Hilme, the floor is yours.
Thanks so much, Dr. Julie Dargis, and really excited and welcome. I see that people are still trickling in on our Zoom side event for the UNGA or UN General Assembly. I'd like to welcome all of you from around the world. This is a very important virtual UNGA side event to have your expertise shared and for us to learn together. We are grateful for our members that are speaking today and sharing their expertise. I am currently in New York at the UNGA 78 meetings, and climate and health is a big priority. We're hearing again and again that increased political will, community-led decision-making, and consistent investment in climate and health initiatives are necessary. The big action point, though, will be after all these meetings, how does that momentum and commitment carry on? And so just to let all of you know that are joining us, and for our core group members and beyond, that this will be a high priority for us, as it has been in the past year. And we will be continuing these side events and technical sessions. The main aim right now of UNGA 78 is to address this multifaceted global challenges that we face around the world, and really identifying those approaches to expedite the progress toward achieving the 2030 Agenda for Sustainable Development and the SDG goals. We know we are not there. We are not even halfway to meeting these goals, and there is a lot of work to be done. The challenges are being referred to as the global polycrisis, one of these main determinants being climate. And so side events as this during UNGA, but after UNGA, also provides the global health community with a platform for us to come together to share knowledge and to collaborate, and to really make sure we expedite action. And so all of these important matters on health equity, climate, and health bring us together. And this is really the mission of core groups. So thank you for joining us today. We know currently there are about 9 countries that are on the brink of famine. The WHO has estimated that the direct damage costs to health from climate change, excluding agriculture, water, and sanitation, will be $2 to $4 billion per year by 2030. And that's excluding agriculture, water, and sanitation. We know there's mental health effects linked to the increase in temperature. We see climate change anxiety manifesting in younger people, as well as medication interactions with this temperature regulation of individuals that have mental health conditions. So there is a lot to do. These are just a couple of the statistics related to the impacts on our health related to climate. And there's really an urgency to bring all of you together for this collaborative action and advocacy. And as I said, core group will continue these technical sessions. I'm very excited to open this side event. And thanks to all of you who are joining us around the world today. And so Dr. Dargis, back to you. Thank you so much, and welcome everyone.
Thank you, Lisa. As Lisa noted, our esteemed panel is coming to us from around the world. I would like to ask Kate Kabori to introduce our panelists to us. Kate Kabori, the co-moderator of this event, is the Global Health Fellow of Core Group. Kate?
Thank you, Dr. Julie Dargis. Our panelists represent the depth and breadth of our members around the world, and it is with pleasure that I introduce them today. We have Anne Kuntz, joining us from Washington, D.C. She's a senior advisor at Relief International. Next, we have Dr. Sean Baker, who was the chief program officer at Helen Keller International, joining us from Ouagadougou, Burkina Faso. Next, we have Ms. Javaria Afzal, who is the climate change advisor at Health Age International, joining us from Pakistan. Last but not least, we have Ms. Lindiwe Shola Mazala, who is a certified expert in climate change and renewable energy finance, joining us from Eswatini. On behalf of the entire team of Core Group, I would like to offer a warm welcome to all of our panelists today.
Thank you, Kate.
Thank you, back to Julie.
Thank you. And again, I just want to remind you to use the chat box. If you have any questions, we would be very happy to engage with you. All right, so I'd like to start this conversation off with a question to all of the panelists so that we can set the stage and get a sense of where you're at this moment with climate, at the nexus of climate and global health. And one of the question that I have to start with, I'd like to start with you, Dr. Baker. What is Helen Keller International currently doing to better understand and address the realities of climate change that you are currently facing in your global health program?
Thanks, Julie, and thanks to Lisa and Kate and to all of Core Group for organizing this. We're facing a real dilemma. The climate crisis is a malnutrition crisis, which is not necessarily fully recognized. Every system that families rely on to nourish their children is being disrupted at the same time. And it's also exacerbating pre-existing inequities. The Lancet series in 2021 underscored that socioeconomic inequities persist as a major determinant of malnutrition. And you can read the literature, but then also when you visit, for example, in June of this year, I was in Bangladesh in the Chittagong Hill Tracts visiting one of the programs we support through funding from USAID, the Bunderban Agriculture Nutrition Initiative, and some of the most marginalized communities in Bangladesh. And we just received reports recently of incredibly devastating floods. To give an order of magnitude of those floods, they received 668 millimeters or 26 inches of rain in a 6-day period. These devastating floods, which are of historic proportions, have destroyed food supplies, livelihoods, and access to health facilities. So the climate crisis, this is just one manifestation, is a nutrition crisis. But at the same time, unfortunately, the health system, which is the essential platform for delivering nutrition-specific services, is largely failing to do so. And it's certainly failing to reach those most in need and failing to flex rapidly when those needs increase. And just a couple of examples of that. If you look at treatment of severe wasting, the deadliest form of malnutrition, globally, despite this incredible, highly cost-effective life-saving intervention, we only are reaching about 30 kids in need of treatment, and that's heavily skewed towards humanitarian settings. Health systems and non-humanitarian systems are largely failing to deliver this intervention. Looking at pregnant women who are increasingly facing challenges meeting their nutrient requirements. Globally, in low and middle income countries, around 50% of pregnant women attend antenatal services, but only 35% get even 90 iron folic acid tablets. I was just in Sierra Leone again earlier in the year, and there the gap is much larger. The opportunity is huge. 90% of women, 90% are attending at least 4 prenatal visits, but less than 30% are getting even the minimum iron folic acid. And so this is a huge opportunity to not just transition to more effective multiple micronutrients, but make sure we're using that to supercharge access to the nutrients that moms need during pregnancy. So there's really, to my mind, an urgency to empower the health system, particularly focusing on community health workers, to scale up a continuum of 5 life-saving nutrition actions with a huge focus on equity and those who are particularly affected by the climate crisis. Thank you.
Thank you, Dr. Baker. I'd like to ask Javeria if you could talk to us about HelpAge and how your organization is working to better understand the effects of climate on your programs. Please.
Thanks, Julie, Lisa, and Kate, for this very informative discussion on the sidelines of UNGA. I think within HelpAge, we are focusing on integrating climate change consideration across all our program pillars, and we at HelpAge we call them portfolios. And in addition to exploring entry points to amplify the voice and role of older people in climate debates, so to advocate for age-inclusive climate actions and solutions. And within HelpAge, we do have a dedicated portfolio focusing on healthy aging. And through the climate change lens, the focus is to build the resilience of older people to pandemics, to health crisis. And we already know that climate change is having a really amplified and magnified impact on the health risk and the crisis faced by the communities at the local level, but also at the regional and at international level. And because of the climate change, the health of older people especially can be manifested in different aspects, ranging from increased mobility issues. They are at risk from heat-related illness, but also in terms of their ability to cope with the sudden changes because of the cognitive issues. So I think it's very important that we need to ensure that older people are part of discussions when it comes to health services, home care, or the care services provided by the government, and taking into consideration the physical and the mental well-being of older people. At HealthPage, within our health programs, we are promoting community-based health approaches. And the idea is to have a very holistic approach in terms of promoting and engaging older peoples to taking care of themselves, but at the same time building the capacity of volunteers and building the capacity as care workers so that they can better care of older people, but at the same time capitalizing on the capacities and skills where they can advocate themselves and help government accountable to give them access to quality health services at all times, whether it's calm times or whether it's times of climate crisis. I'll stop here. Thank you.
Thank you for your comments. I appreciate them very much. I'm going to shift over to Anne and ask you the same question again to set the stage from your perspective. Could you please share what Relief International is focusing on as it relates to climate? Anne?
Sure. Thank you, Julie. So first of all, at Relief International, we had to be honest with ourselves that especially in the humanitarian field and programming for refugees and internally displaced people, or IDPs, we're still on a steep learning curve. And when it comes to climate change mitigation and adaptation, in the humanitarian field, we're used to responding and reacting to the impacts of climate change, say a flood or a drought. But increasingly, we have to work with communities to anticipate and adapt to the climate change impacts. And this is through disaster risk reduction, or DRR, planning and mainstreaming into our programs. For RI, it also started with explicitly in our organizational strategy, calling out climate change impacts. We're now working to integrate those climate change factors across our main sectors, which include our health and nutrition programs, water, sanitation, and hygiene, or WASH, livelihoods, and education. But more importantly, also our operational departments, which include our legal, procurement, and security areas. So specifically, just to give a couple of quick examples, in our health programs, this means being much more proactive in our disaster risk reduction planning and identifying not only the climate and other hazards that impact the health of our communities that we work with. So anticipating the climate hazards meant, for example, in South Sudan, really looking at how do we change our procurement practices so that we're not getting stuck and supplies can't get through during the flooded seasons. Understanding the stresses that are exacerbated by climate change that may start from conflict or land use change. And these include specifically for refugees and IDPs when there becomes added tension between host communities and the refugees and IDPs that are climate influenced. And it's already been mentioned, the things is also to not overlook the mental health needs in climate change. Those are just a few of what Relief International is doing, and I'll stop there. Back to you, Julie.
Thank you, Anne. It's an interesting, the theme of integration and is emerging here. So let's move from Washington, D.C. into Eswatini and welcome again, Linda Wei. Please share your thoughts with us on how you're addressing and better understanding how to address climate issues around global health. Lilindwe?
Thank you very much. So for APT Associates, as I mentioned, we're implementing the Health Electrification and Telecoms Alliance, which brings through the nexus of health, energy, and telecoms. First and foremost, we are both in climate change mitigation and adaptation. So from a mitigation perspective, we are co-creating with the private sector. We are using our funding from USAID as seed funding to leverage in private sector and other donor support to rolling out renewable energy solutions for health facilities in sub-Saharan Africa. We do understand that there is a huge challenge of an excess of about 100,000 health facilities that are not connected to the grid. Our target is to start off with 10,000, but to scale up from there. So not only are we replacing the use of diesel, the use of coal, which tend to be unreliable, which tend to be costly, but we're bringing in cleaner solutions and more reliable solutions. And on the adaptation side of things, it's bringing in resilience. As previous speakers have mentioned, our countries are susceptible to flooding, to extreme heat. So with off-grid solutions using solar, at least we are able to make sure that facilities are able to be up and running for maybe 3-4 days after there's been a flood, cut off of infrastructure, roads, etc., making sure that our health facilities are still able to access services. But overall, the aim is also just to enhance health service provision, talking from childbirth. Currently, I think most participants would know in some hospitals in Africa, childbirth happens with a torch, very little light, really a lot of equipment, very fundamental equipment runs on power. So powering health facilities is strengthening through renewable energy, strengthening resilience in that sense. But also bringing in the telecoms aspect of things, making sure that the clinics and health facilities are able to transmit data, able to communicate. Telecoms has become an important aspect of the health sector. And then I think the whole aspect of pulling in the private sector, I think, is important for us. The health sector has primarily been thought of or known to be a social sector, largely dominated by government and NGOs and other donors. But now I think through our approach, we're trying to pull in the private sector a bit more, help them innovate in that space. And then last but not least, we're also focusing on women and youth, making sure that the gender dimensions are taken care of, but also pulling in youth. We've got a large youth dividend within the sub-Saharan Africa. So let's bring them in and see how they can be involved, either from capacity building or in other means, making sure they're part of the value chain. So thank you very much. I'll expand a bit more later. Thank you.
Thank you, Linda Way. I do appreciate you being here, and I think it's a wonderful perspective to bring in that private sector perspective as well. So I'm really happy to have you with us today. So yeah, I'd like to now work with the panelists to delve a bit more deeply into the work that you're doing. And again, we're welcoming you to ask any questions that you may have in the chat. We'll be monitoring that, and we'd be happy to answer any questions along the way, and the panelists will also engage with you in the chat. So to start with a deeper dive into what our core group members are actually doing in the field, I'd like to welcome Dr. Sean Baker, the Chief Program Officer of Helen Keller, to speak on nutrition, nutrition considerations in primary health care and climate. Dr. Baker, the floor is yours.
Thank you again, and I'll repeat what to me is one of the key messages I'd like to get across, that indeed the climate crisis is a nutrition crisis. And if you could jump to the next slide. These next two slides should be pretty overwhelming. And some of my colleagues were saying, wow, these are just too text dense. But in fact, I wanted to be overwhelming because when you look at the evidence about the impacts of the climate crisis on nutrition, is quite fragmented. But when you roll it all up, it is really overwhelming, the evidence that indeed the climate crisis is a nutrition crisis. And perhaps the three key messages that come out of this slide, and if you could jump ahead to the next one, I don't anticipate that people will read every one, are indeed the impacts are very grim and hit populations who are already suffering risks of malnutrition. Two, that it really is exacerbating underlying inequities. And three, not only is it grim in terms of future progress, it's eroding progress we've already made and could lead us to backsliding. Now, that's the bad news. I think from a health sector perspective, and if I can go to the next slide, there is good news. And here, again, I come back to what the Lancet series said in 2021, and I put up what is some rather dry academic text that about health systems. But how I translate it is basically in terms of delivering these life-saving transformational nutrition services, the health sector is largely missing in action. And a couple of data points there looking at access to antenatal services, prenatal services, which are improving dramatically. In red, you see the red bars. But then in this case, mapping are those moms who make this incredible effort to attend for prenatal services, are they getting a minimum of their 90 iron folic acid tablets? And you see we're missing huge opportunities to do it. The second set of graphs is looking at moms who, again, make the effort to make sure they're delivering in a facility. And you would think immediately those moms would be supported to initiate breastfeeding within an hour, which really establishes optimal breastfeeding behavior for the next 2 years. And again, we're missing these opportunities, which is both, I think, a public health missed opportunity, but also, in fact, a misuse of mothers and their families' time. But I'm an optimist, and I see these gaps. When I see a map like this, I see, wow, if we can just close those gaps, think how much impact we can have. And if I go to the next slide, and what we're really focused on of scaling up are really 5 life-saving nutrition actions where there's incredible evidence that delivering these at high coverage and high quality will have dramatic improvements in reducing deaths due to undernutrition and improving a whole host of other outcomes. So prenatal vitamins in that pregnancy period where moms absolutely need access to good nutrition. And we're looking at both how do we improve performance of existing iron folic acid tablets, but then really transition and re-energize maternal supplementation, prenatal supplementation by moving to far superior prenatal vitamins, which contain a whole host of nutrients and not just 2. Obviously, continue to focus on supporting mothers and families and whole communities to establish optimal breastfeeding, initiation within 1 hour, exclusive through 6 months, and then continuing. And during that continuation period, really focusing on enriching children's diets. Across low and middle income countries, only 19% of kids in that critical 6 to 24 month age group are getting a minimum acceptable diet. So we really need to hone in on how do we support families. And there's a great new innovation of lipid nutrient supplements, which can help in those situations. And then, of course, one of our signature programs, which in fact is probably one of the nutrition interventions that is arguably done the most to go to scale, is vitamin A supplementation every 6 months. And then how do we take advantage of all the innovations of treatment of acute malnutrition to get kids detected if they need treatment, get them identified early and on quality treatment. And if we have this continuum of interventions with a big focus on equity and quality, we can really have the health system dramatically respond to the increasing nutrition needs of populations suffering from the climate crisis. If I could go to my next slide. And then stepping back, and maybe you just flip through all of these instead of going one by one. I see 5 things we really need to do as a health sector. First is to name it. Really elevate the understanding that malnutrition is the deadliest manifestation of the climate crisis. Most kids who are going to die from the climate crisis are going to do so because of increased nutritional risks. Analyze it more so that we have a better idea, we can better quantify what are the impacts, and very importantly, who are the populations most effective. Obviously, accelerate delivery at scale, which I've already spoken to. We also need to engage effectively with the food systems, because obviously food systems are under real challenges to be more sustainable, reduce their greenhouse gas emissions, but we cannot let these adjustments come at the cost of access to nutritious foods for moms and kids. And then a renewed focus on equity. We've got to reach those most in reach, and remember that these moms and kids at risk of malnutrition because of the climate crisis did nothing to contribute to the climate crisis. And then I'd like to close. Just a year ago today, there was a pledging event to scale up access to prevention and treatment of acute malnutrition at the UN General Assembly. And I was in the audience when the Goodwill Ambassador from UNICEF, Vanessa Nakate, who is a young climate activist, spoke. And she had just come back from a visit to the Horn of Africa and was devastated meeting with families. And her concluding remarks to me are stronger than anything I could say myself. Those that are suffering the most are the ones that are least responsible for this crisis. There is no climate justice without nutrition justice. Thank you so much.
Thank you, Dr. Baker. We have a question, and I'm wondering if you might be able to address this from Patrick Okello. He asks, what are some of the measures that you are using to help with ensuring that climate change does not continue to contribute to the emergence and reemergence of diseases, especially the zoonotic ones? Is that something you can speak to?
I'm not going to be the most qualified to speak to that. And I do think it's an important question, but there are probably other panelists who can speak more knowledgeably to that.
Okay, we'll hold that, and we'll resurface that in our follow-up discussion. Thank you again for your remarks, Dr. Baker. Our next panelist is Javeria Afzal, the Climate Change Advisor from HelpAge International, who will speak on intergenerational approaches to climate challenges in global health. Javeria, the floor is yours.
Thanks, Julie. Let me just give a few brief about what HelpAge is doing. So Julie, if you can move on to the next slide. So HelpAge is a global network of organizations working in 90 countries, and we work for the rights of older people. I think before I jump into the discussion and the topic that I'm going to speak on, I think it's very important to look into why climate change is older people and what is the connection between these two themes. I think we are in extraordinary times where the world is both warming and aging. If you look into the statistics globally, we are 1 billion older people. Today, by 2030, it will jump into 1.4 billion. And by 2050, 1/5 of the global population will be older. This means that the demographic of your population is changing and the world is warming at the same time. So I think both these issues, if dealt in siloed manner, I don't think would bring a lot of advantage for the social or economic development of the world. And it's both important that both issues are taken together. And as by 2050, almost there will be 2.1 billion older people, and most of them, almost 80% of them, would be living in low and middle income countries. And we all know that the low and middle income countries are the hotspots of climate changes, where there are climate-induced weather events, there are high temperatures, sea level are rising, and there are ecosystem destruction happening at the same time. Older people have existing vulnerabilities. I talk about them when I open my discussion in terms of lack of mobility, disability issues. They at the highest risk from the heat-related illness. And we have seen this in summers in South Asia, and it's daunting to see a high number of deaths within the older people because of this heat waves. Poor diets. My colleague Sean has already talked about malnutrition in children, but what we are seeing is that older people also have low nourishment as they age and becomes more vulnerable to climate changes. And older people, of course, have difficulty adjusting to these sudden changes because of their cognitive issues. But I think that the good news is that, Julia, if you can move into the next slide. I think, but the good news is that as the global population is aging, with thanks to development in the health sector, people are living more longer. So in a way, we can utilize this older group, their role and voice that can support a fight against global warming. What we are witnessing in our communities from our field areas, that they are practicing climate action. and are transferring this knowledge to the younger population, to the middle-aged groups. We all know that the older people have a political voice that can make system more resilient, and they can also be a stimulant in terms of bringing a behavior change in terms of low carbon living or standards of living or the way how we live. And of course, they have financial capacities and savings that could be utilized for a sustainable world and investing those savings in a sustainable manner. So I think in a way, older people have vulnerability, and that's what we used to share a lot. But at the same time, I think the effort should be made in terms of how they could be bring at par with other stakeholders who are talking about climate change, and just because of the fact they have the knowledge and wisdom that they can share. If we move to the next slide, I'll just now talk about the intergenerational approach. So what is intergenerational approach? It's about like bringing the two generations together, and we within HelpAge are considering as one of the approach as we do and implement different projects and programs in the communities. And the idea is to encourage generations to come together to talk about their issues, so that they can create mutual benefit and to have more coordination and communication around issues as well. And then once we bring the generations together, they can talk about their mutual vulnerabilities. And we all know younger people are vulnerable to climate change, so as the older people are vulnerable to climate change as well. But they both have agency. So how do we bring those groups together for the mutual benefit of the societies and take on climate actions and climate solutions? For HelpAge, intergenerational approaches is something not new. 2 years ago, a team of ours had produced an intergenerational guide that talked about how different projects and programs in countries globally have taken intergenerational approaches. And one of the sectors is, of course, healthy aging. But at the same time, we are trying to understand whether, and are testing the assumption whether intergenerational approach works on climate action or not. So we are piloting a project in Nepal and Uganda, bringing the two generations together, and we are developing the methodology right now. And the project is being implemented in partnership with Restless Development, who are working with youth groups, and with Newcastle University, who are providing us a research and methodology support. So I'm really excited that this pilot project would provide us the meat that could be able to highlight what are the necessary ingredients that can help us to bring the generations together to take on climate actions. So Julie, can we move on the next slide, please? Earlier this year, HelpAge did a scoping study, and we wanted to look into what are some of the opportunity and challenges out in the world that can bring the two generations together. And it was a little maybe eye-opening for me that the voice of older people was completely missing in climate debates. You know, there was a lot of discussion on the warming world, and how species are going to be distinct, you know, and how the ecosystems are going to be destroyed. And all the governments are giving priority to climate change, which is excellent, but at the same time, the connection with the aging population is missing. So your IPCC reports, your UNFCCC data is completely blind on this demographic shift. So it's very important that we bring this narrative on the table. We also see there's a clear ageism in the climate change framing. There's a lot of youth activists, which is great, which is excellent. But at the same time, older people are seen as deniers and blockers, you know, which I think is not a right approach and right thinking that, and it's very opposite to what we are seeing in the communities, where older people and younger people want to take actions together. So just to, you know, bring your focus to this code, you know, so we are implementing a Kenya drought response project in Horn of Africa. And while we were doing the need assessment, one of the community members said that there is no food. We have only got a bit of sorghum left. It's more or less finished. My grandchildren go to the bush to find firewood to sell, and they look for wild fruits. That's how we survive. And there's a wish that I wish the next generation does not experience the disaster that we are experiencing now. So you can already see that the older people as stewards for the future generation, and they would never like their young generation or the next generation to face the same dilemma that they are facing. And we can clearly see that in terms of their vulnerabilities and capacities are not reflected as well. So there is a need to come up with more projects or intergenerational approaches just to test learnings and future outlook as well. I'll just give a dive into some of the examples from intergenerational approaches in health. We have successfully implemented intergenerational self-help clubs project in Vietnam, which is all of a community approach on healthy aging. We are promoting physical, mental health, and psychosocial well-being. There are almost 3,000 these self-help clubs, which are catering to almost 160,000 population right now. We are training the volunteers on home-based care, and they are delivering services through care workers and developing a need-based plan, and then they follow up through different visits. We almost have 16,000 caregivers as of today, providing regular care to 10,000 plus clients. And the idea is to mutually develop a plan of action, and then monitor them, set targets, and then follow up with the regular visits. So I think that's an excellent example that has been reported globally in different documents as well. We also, in terms of intergenerational approach, it also works really well in healthy debate in the global health scenario as well. During the Ebola crisis in Sierra Leone, and we have utilized the same youth groups for our COVID response as well. So the young groups and the young people have worked with the older people associations. And the youth groups were provided by another organization. We helped them partner with the OPAs so that they can talk about how to prevent and protect themselves from the disease outbreak. They have talked about hygiene, and younger groups has really monitored the older population, how they are doing on aspects and the needs that they have identified themselves. And I think what was really classic about this methodology was that the same groups, once they have integrated into intergenerational groups, they have been used to strengthen the business capacity for the livelihoods of older people. So not leaving them in the response and relief phase as well, and really building the resilience so that they can go better with the next crisis. And I think it was very heartening to see that they were able to have some saving schemes, so that able to fund upfront capital to some of the emerging businesses that older people were working on. So I think that's a very exciting example where generations can come together and talk about their issues as well. So I think I'll just end my presentation here. Happy to take any questions you might have, and thank you, Julie, for giving me this opportunity to talk about that. Thank you.
Thank you so much. This is so interesting, and you've answered so many of my questions, because I really think it's a beautiful connection with the intergenerational approach. And I was interested to see some concrete examples which you provided to us. Could I just ask you, before we move on to our next panelist, are there any other activities that you're thinking of to bring together the different generations? Is there anything else that you'd like to do in addition to what you're already doing?
Yeah, so Julie, as I said that, I'm really, because as I said, I came from a very strong climate change background, and within this practitioners group, we have never talked about intergenerational approaches. So the pilot project that we are doing in Nepal and Uganda, the idea is really to test this assumption whether intergenerational approach works in climate change or not, So once this pilot study is done and we know what's happening and what works, then bring the generations together. I think that will be very helpful in scaling up these projects globally, and more so in the developed world maybe as well. So maybe we can have contrasting case study. How does it look like in the developed world and in the global south as well? So I think this is something that we're testing currently.
Thank you kindly for expanding on that. And thank you for your very, very good presentation. Oh, I'd like to continue this discussion now with Ann Koons from Relief International, who will discuss the nexus of refugees, IDPs, internally displaced persons, and climate. Welcome, Ann.
Thank you very much, Julie. You can move to the next slide, please. So we do know that there's more displaced people globally than ever before in our human history. And the global health impacts that are exacerbated by climate change are, my fellow panelists have already covered so many of them. I have brought together in my presentation, and I know it'll be available for all the participants afterwards, in the notes section, some reference to different maps and figures. So they'll be there. I encourage you to look at them later. Starting with the big picture in 2022, the number of displaced people worldwide, and the fact that, and thank you for putting the first bullet up, that the majority are internally displaced people, or IDPs. They then start to break it out and try to figure out, well, what's the main driver? And you can see that disasters account for a higher figure than conflict and violence. While we can project that we're going to have more displaced people, what we have to get better and able to serve the health needs is looking especially internally, where might those people go given the type of disaster, and try to be proactive in being ready for providing those health services. So for example, in a flood, there are good flood maps that are available, but they're very rarely linked up with the health sector to be able to project where might those people need to go, either temporarily or longer term, so we can start to shift our health services. Next bullet, please. We also know that climate change enhances the disasters, but we can't overlook that it interacts with conflict, land use and water changes, biodiversity loss, zoonotic diseases, as one of our participants has asked about. And this increases the health impacts for humans, and many of those health impacts have been already mentioned, so I won't go down through those again. But it's also, we have to remind, it's already coupled with weak health systems. So whether you're internally displaced or a refugee, you're going to be potentially interacting with host communities or regular health systems that are already under stress and not coping with before these additional climate change risks came into play. It's a bit of the chicken and the egg. Which is influencing which? We have to understand them all and not debate. And I really hope as we work to get more funding and resources, we don't fall back into some of our bad practices where you had to demonstrate, oh, this is due to climate or conflict to qualify for money. We need to focus on what we're trying to do to stabilize and improve human health. And finally, my last bullet for this slide, just to note where Relief International is working on health and other services. It's in some of the top countries where IDPs and refugees are located, and they're listed there. Next slide, please. This map I found very interesting from the IDMC. And the orange in there represents displacements that are due to conflict, and the blue due to disasters. So technically disasters does include earthquakes, and that's not yet been tied to climate change, or at least not in as many direct ways, but the flooding, droughts, extreme heat, and displacements there. I wanted to pull out 3 countries where RI works because it's been interesting in some of the shifts. If you look at the Philippines, I think it's to people's far right, it's predominantly blue. And that's showing that most of the internal displacements are due to disasters. And there it's typhoons typically. But let's look at 2 countries that I found a bit surprising. And I know they're a bit hard to see. People may need to zoom in or get closer to their screens. Afghanistan, which is really in the press headlines, the conflicts, the Taliban taking over, the impacts on the population, but really their internal displacements the majority are being driven by disasters, and it's a lot due to drought. Iraq is another country that for years the displacements were driven by conflict, but now the majority, and almost 3/4, has gone to disaster base and lack of water or water woes. So before I move on to the next slide, I would encourage people to look at this and where countries are working, because it really starts to help to understand what are the drivers that might be displacements, and whether you work with IDPs or refugees or not, it will impact the host communities and where the communities we seek to assist. One of my colleagues characterized it is that we're all becoming strangers in our own neighborhoods, that climate change is shifting the context right from under our feet, our homes, the clothes we need to wear, our foods, our habits, and even our bodies are shaped by the climate and season that we inhabit. But habits are built over generations, and they serve as a subconscious for our coping mechanisms. But as we get into, for example, extreme heat, that very quickly is not something not only the human body can't adjust to, but the whole ecosystem around us. Whereas in the US and Europe have tried to adapt more quickly, with the government taking leads on programs to help deal with the heat, we typically are dealing where governments do not have that capacity and are stepping in, and it is falling to the health sector for us to be able to integrate disaster risk reduction warning system and adaptation techniques to deal with, for example, extreme heat. Next slide. First one. So here on climate change and global health, I'll let you read those in environmental. Most have been covered, but want to note that by 2015, it could mean that as many as 140 million people across just the developing regions will become climate migrants, with individuals and family and whole communities that are forced to seek more viable and less vulnerable places to live. The second one on health impacts, again, been covered. I'll let people read some of the impacts. But in addition to these ones noted in the slide, the ones tied just to natural disasters, they're projecting that globally will be a $520 billion loss of annual consumption. So to my fellow speaker on nutrition, that does bring in the ag. But more importantly, it's projected to force an additional 26 million people into poverty, which we know that people that fall into poverty have so many knock-on health effects. And then the third one that I just want to do a very quick, deeper dive into is an example from the dangerous and growing pathogens that are moving. So pathogen-carrying animals and fungus are spreading rapidly into new areas. With longer rainy seasons and higher temperatures, humidity provides an ideal breeding ground for especially mosquitoes. And as the globe warms, mosquitoes are roaming beyond their current habitats and shifting the burden for diseases like malaria, dengue fever, and West Nile virus. Some of the statistics here that they've already grown, but even this disease burden alone is something that is overwhelming our health systems. Next slide, please. So what is RI doing in the approach that we're taking? I wanted to, for the entire community, is to say that, first of all, we're looking at how we need to green our programs and our environmental footprint. Specifically in health program, we're looking to be mindful of where the goods come from and how we can reduce that carbon footprint from the transport, as well as things like single-use plastic waste, and promoting safe clinic disposal waste systems and conservation from the energy we use. For example, switching from diesel generators to solar. I'd say the second one is probably the most important pivot, in that we have to look at more from a disaster risk reduction lens, and one that anticipates the health impacts that are coming from climate change and works with the community to not just treat them once they walk through the clinic door or when our community health workers go out, but think about on a month by month and season by season, what do we need to do for messaging, health messaging? How do we integrate with our other sectors, both in the humanitarian and development fields, so that we are leveraging and not siloing our efforts. So we're looking at how we can take disaster risk reduction planning and that integration much more seriously, so that we can reduce loss of life, injuries, chronic health conditions, and as well as help to promote greater well-being, both in physical and mental health. And the third aspect is adapting to the programs. I've touched on that a bit, so we can move to the next slide. So this is my final one. I'm leading up to that. I've added into the presentation some maps that look at future trends in population, heat indices, displaced persons, as well as water woes. I haven't seen a good map that brings them all together, probably because that would be too complex. What I would encourage you all to look at these. This one, just let's take a moment. You'll see this is on the population one. And it shows where the populations are going to grow. And what if we let this cycle through, you'll see in the Americas, the populations are shrinking. And Asia and Africa is where you're seeing the largest population growth. These also have impacts for where we're going to see stresses in climate, as well as if you look at the maps and start to see the overviews and that integration, what we have to be not only dealing with in real time to address the health needs of our target populations, but also what we have to project into the future and how we have to think about doing things differently. With that, I thank you. And back over to you, Julie.
Oh, thank you, Anne. This map is just fantastic. It's the incredible breathing world, right? And it really gives perspective. So I thank you so much for sharing that with us. I do have a question. I'd like to connect back to Javerier and the intergenerational approach. And in terms of refugees and internally displaced persons, are you seeing a connection through the cross generations or intergenerations to address some of these issues?
I think definitely. And one, I was just recently in Iraq with our field teams, and there it was 107 when I was there during the days. And yet when I went through one of the museums, and they were talking about how did they deal with the heat back before there was electricity and air conditioning. And that's where lessons from our elders are very important, as long as it's coupled with that we're all learning, and we can't expect our climate and our seasons to be the way that we've experienced in growing up. I don't care whether you're 10 years old, 30 years old, or 70 plus years old, but we have to be open to and using that, what are those projections? But when you marry those two up, that's where I see you have some really practical, within reach, actionable items that the communities can take to empower them to be able to adapt to what's coming, what is already here on climate change, and going to be even worse in the coming years.
Yeah, I appreciate that insight. And I do have one more question. I was wondering, you did touch on the zoonotic diseases, and I wanted to go back to Patrick O'Kello's question and just ask you if you might have some insight into that. You talked a little bit about it, but are there some additional measures that you have seen or that you're using within Relief International? That the question is to help with ensuring that climate change does not continue to contribute to the emergence and reemergence of diseases. You touched on malaria and some things, and just so that we could perhaps address this question, do you have any other insights to the question?
Some real quick ones. There's the One Health Network. So for those that don't know on zoonotic, and so One Health is looking at the biodiversity, the ecosystems, the wildlife intersection with domesticated animals, which so many of rural populations, especially livestock, poultry, goats, and then human, and how that disease transmission, zoonotic diseases move between those three populations. If you look at that, they move back and forth. So first of all, we don't have to reinvent the wheel. There's an excellent network, and I would encourage, if your organizations aren't tapped into, they've got websites and materials to sort of get a One Health 101. The second point is that we do know that zoonotic diseases can move, and they can move dramatically. And so quickly, if there's surveillance systems, and there's through the Grown Group, and CORE has done some work on this, like when COVID came up, as they're identified, getting those best practices in so we can spot the diseases quickly in a setting, start whatever treatments, and hopefully contain or give people how they can, deal with that. It depends on what, zoonotic disease. We cannot assume that things are going to be the same. They are going to rapidly change, and we have to be prepared for that. That's just a couple things. I know we have to get to the next speaker.
Very helpful. Thank you so much. And again, I'd like to encourage the participants. We will be having a discussion after our next presentation. And please do ask your questions. Thank you kindly. And again, thank you for this amazing map. So Lindawe Malaza is the Chief of Party of the Health, Electrification, and Telecommunications Alliance, HETA. And she's representing APT Associates, and she will speak to us about approaches and findings from HETA project on climate. Welcome, Lindawe.
Thank you, Julie. Thank you very much. We can move to the next slide. Okay, so just briefly, HETA is a USAID USAID Global Development Alliance. And as mentioned previously, we are guided by country health priorities. So I think most have been mentioned, the need for access to electricity by health facilities to be able to run their equipment, but also digital connectivity, which becomes also important, particularly to your question, Patrick, and to what Anna's just mentioned around making sure that, health facilities can communicate, can spread information about which diseases are emerging, level of vaccines, etc. So I think as I go through my presentation, I'll try and touch on both the questions that are in the chat. And then, as also previously mentioned, we are co-financed with the private sector. So we strongly encourage private sector participation. And what is different is that we're trying to look beyond the traditional procure, install, move out type of models. We are looking for more sustainable approaches, particularly around operations and maintenance, which is a key challenge. I think one of the previous panelists mentioned that, sometimes we provide solutions and then we move out and leave government to sort of struggle along with those. We are bringing in seed funding from the US government of $47 million, but we aim to catalyze between 100 and 150 million from our partners. And our aim is basically to accelerate action through promoting of climate smart energy to power resilient health systems. Next slide. Next slide, please. Thank you. So we have a partnership-driven approach. Our main partners are Resolve and Bechtel.org, as well as Orange, but mainly we go through a co-creation process, which I'll touch on a bit later. And we have other alliance members that are partnering with us to help us realize our vision. Next slide. So in terms of our highlights from our first year, we've got 10 country programs that are up and running. Our focus is Sub-Saharan Africa. So we have programs running in Eswatini, Tanzania, and DRC. And then we've got a pipeline coming in from Guinea, Nigeria, Kenya, Malawi, Mozambique, Sierra Leone, and Uganda. So far, we have about 75 health facilities that are up and running with climate smart energy and digital connectivity solutions, supporting healthcare and healthcare access and quality. And by the end of November this year, we aim to have reached about 300 more facilities with improved access to clean energy and digital connectivity. So far, the leverage is about 1.3 million, but like we mentioned, our target is between 100 and 150 million, that is additional co-funding to what HETA is provided. And we have more than 35 alliance members. So we've got the 4 founding partners, which I mentioned. And then at country level, we've got about 14 partners who are on board, and we've got quite a number of MOUs and other partnerships in the pipeline. Next slide. Next slide, please. Thank you. So I think this is the important aspect, and I think the interesting one to our HETA approach is the co-creation. So we have an open call for concepts where we invite interested private sector or other type of organizations to submit concepts for solutions for any country within the sub-Saharan region. And this is where we achieve the innovation. So the private sector, I think, brings in innovation in terms of approaches to our solutions and productive uses of energy and digitalization packages. So the approaches don't only focus, I think, just also answer Demilade's question as we go along. Our approaches don't focus entirely on health facilities alone, but I think bringing in the private sector allows the opportunity to look into supplying digital connectivity solutions and electrification to the communities around these health facilities. And that's what brings in the cost effectiveness. So working with, enabling legislation, depending on the country, that's where we realize the innovation, that's where we realize the cost effectivity. And then including wash components into these systems, also answering Patrick's question, that's where we are also supporting. We may not prevent re-emergence, but supporting health facilities respond to, pandemics like your COVID. So we provide the grant funding, which unlocks private sector capital. So we provide seed funding, basically. Next slide. Next slide, please. So I'll just touch through a few examples where we are doing work, starting with Eswatini. So in Eswatini, we have two organizations that are currently on our priority list and have been given grants. That's UNICEF and the Look Commission. What is interesting, let me give an example of the Look Commission. They're bringing in a containerized solution, but also some of these organizations like UNICEF have gone as far as developing PPPs with local municipalities who are providing land, who are providing security. So that really reduces the cost of establishing these sites. So they bring in containerized solutions, and through the internet connectivity, they're able to supply services beyond just the health facility, but they provide internet services to communities, that way reducing the operational costs and making it a bit more cost effective for their facilities. Another example will be in Nigeria. In Nigeria, we are partnering with PIND, which is Partnership Initiative in the Niger Delta, where we have about 12 installations of containerized solutions, solar PV, for about 15 to 20 kilowatts of electricity. And they are providing solutions to last mile customers, basically those health facilities that are unable to access the grid. And they are matching our funding by about 2 to 1. And then you've got Tanzania. Tanzania, one of the initiatives there is with the Christian Social Services Network, where we are electrifying about 30 facilities. And HETA's contribution goes towards procuring equipment. But then the CSSC has brought in leverage through the Caterpillar Foundation, who has contributed towards installation. And they're also working with Vodacom on bringing in digital solutions. So the partnerships are really important. In the interest of time, I won't go through all the examples. We can move to the next slide. I think we can share a bit more on that later if it comes up. So just to highlight that our solutions range from battery storage only to solar home systems, to battery storage plus solar. We also oversize in some cases, allowing for growth. Within the health facility, some health facilities can upgrade, bringing in more equipment, requiring more power, but also looking at communities around these health facilities where there's an ability to then extend some of these services to the communities. And we also look into mini grids. Some private sector developers would develop a mini grid, supply power to the health facility, but also sell power to communities around, bringing in the cost effectiveness once again. Next slide. And then in terms of tracking our progress, we do have an indicator where we'll be closely monitoring our greenhouse gas emissions, therefore keeping ourselves accountable in terms of what we claim to be doing. So that is something that is a priority to us, tracking our greenhouse gas emissions moving forward and we'll be doing that annually. Next slide. So just to conclude, our work basically is at the nexus between the health sector, between the energy sector and the telecom sector, supporting the transition towards clean energy, but also supporting health facilities with their connectivity requirements and improving overall access to health services. But also just to maybe, if in the interest of time, Patrick, I think, looking back to the COVID pandemic, I think where HETA plays a key role is, one, supporting the cold chain, ensuring that we've got enough power to support our cold chain, our vaccines, and our critical medication, which are key to responding, to these zoonotic diseases. But also the telecoms aspect of it became very important during COVID. I think, as Anne mentioned, the aspect of, spotting diseases, where are they emerging? How many are they? Communicating who has vaccines where. So the comms aspect become very important between health facilities and government, but also between health facilities and its patients. So at some point we could not move, but health facilities still needed to communicate with patients. So bringing in the telecoms aspect is very important, and powering those with solar power as well to enhance the resilience aspect of it. And then lastly, the WASH component. A lot of our solutions are bringing in WASH components, which become very critical in responding to some of these diseases. So I'll end there for now. Thank you very much, Julie.
Thank you, Linda Way. I just wanted to go back to the questions from the chat. You touched on them briefly, and from Demilade, she had asked about the intersection between climate change and renewable energy, specifically in Eswatini, if there's any cost-effective solutions that are being used through the private sector in Eswatini. And I just wanted to raise that question again in the event that you might have some additional comments on that.
Okay, I touched on Eswatini, but also expanding to other countries. So what brings in the cost effectiveness? One, fortunately, these renewable energy technologies, the price is coming down significantly over the years, especially solar. But secondly, the approach is looking beyond just the health facilities. So we're bringing in solutions where our solution providers are looking what the enabling legislation allows, both on telecoms and electrification, and bringing in, for example, ideas around net metering, the mini grid, so that you're not only serving health facilities, but you're serving the communities around, and that brings down the prices and it brings in revenue generation, which enhances the cost effectiveness. In fact, in some countries, we've seen solutions where through that approach, the health facility actually then receives power for free, because all these other services that they're able to provide actually then subsidize the costs.
Yeah, well, thank you for that additional input. I do appreciate it very much. And again, if there are any other questions, we've had a wonderfully diverse group of perspectives on approaches to address climate and global health equity. Many thanks to all our panelists for their presentations and for the questions that we've received so far from our participants. Please, if you have some additional questions, we have a few minutes now. I'd like to have it before we go into the third and final segment of the conversation. I'd like to pose any questions you might have to the panelists. From Jennifer Nielsen, there is something I'd like to share. And thank you again, Linda Way, for that fantastic presentation. Jennifer Nielsen says, maybe more a comment than a question, but there also are ways in which impacts on climate and nutrition affect food and health systems simultaneously. Increasingly, to expand treatment coverage, we are testing local recipes to rehabilitate children with moderate acute malnutrition. As climate disasters and CO2 heat undermine food production, it will also undermine those efforts. On a positive note, renewable energy offers enormous potential for fueling enterprises in food preservation and transformation with lower CO2 emissions. Thank you, Jennifer Nielsen, for that comment. I'll open that up for the panelists, and if you have any additional comments on that. And again, if there are any other questions, please do share them now and we will get to them. The floor is open for any comments in general as from the panelists. Yeah, that's very interesting. Yeah, go ahead, Javeri. Oh, excuse me.
Yeah,
Javeri, and then Anne, you're on deck. Yes.
Yeah, I think the earlier point about, Anne's presentation about displacement, and I think I see a really interesting linkages, because I think what some of the evidence that we are getting from our network members is that the displacement for older people has different implications, and what we are seeing is that a lot of time older people are being left behind as people move because of climate crisis, or because their land is no longer suitable for grazing for animals or food production. So so older people has a different types of vulnerability when it comes to displacement, but we can't generalize it across regions. And what maybe in Southeast Asia, we're seeing that older people are also moving along with the younger population. So I think that there are different dynamics if you zoom into what's happening at the regional scale.
Thank you, Javeri. Thank you, Javeri. Anne? Yeah.
I think on, and I'm sorry, Sean, I'm sorry if I tread into yours, is that using some of these projections and also advocating with donors to not fund such silo things. So I know I have sat in East Africa pleading with our humanitarian donors who were doing, funding the evidence-based malnutrition programs. So I said, can we have a little bit for seeds and so or even implementing the livestock emergency guidelines standards legs, which tends to be in an ag program somewhere. And it may be that they don't have the funding for both. And so those preventive measures that could not cause as many children to go into malnutrition, what we have the tools at typically get squeezed on funding. So I would say that across our whole field, maybe to advocate more for that on that integration.
Yeah, thank you for that. I was actually going to respond to something else you said that to me strikes a chord of the dangers of trying to deconflate. Was it conflict that created this displacement, or was it climate? I'm sitting here in Burkina Faso where the two are so intermingled that it's impossible to deconflate, and we really need to make sure. And I think in that same vein, and responding to your comment of most of the countries we work in, the good old days when I started, if they were good, yes, there was a pretty clear divide. You had true crises and you had development, but almost every country we work in is in this continuum. And having worked in a large donor organization, the silos that are created by appropriations of you do development versus you do humanitarian response they're just not in tune with the realities of what our partner governments are facing, our communities are facing, and how do we make sure we are ensuring a continuum of services to build the systems that really, first and foremost, empower communities and the government systems to have that capacity to respond to increased needs created by any crisis. And again, I really take your point that the crises related to conflict and climate are so intertwined that if we're forced to try to say, oh, well, this one was created by a climate crisis versus that was a conflict, it's going to be an exercise that will be totally self-defeating.
Yeah, thank you.
I totally agree.
Mm-hmm.
Sorry,
Yeah.
Julie, I just wanted to add that,
Please.
Noting that this is taking place during UNGA, I think this is a very important conversation that needs to feed back into the discussions that are taking place within UNGA, because this is sort of the place and the platform where some of these, financing sources and agreements are discussed. They filter in maybe to the UNFCCC and other mechanisms, but I think it's a very important point of, moving away from the silo approach and looking more towards nexus approach and streamlining that into the way we structure our financing.
Yeah, that's brilliant. I'd like to now ask the panelists to take us into the future, if you will. And I'd like to start with you, Linda Way, with a question in terms of what are the innovations that have been most promising to adopt global health programming and mitigation strategy to a changing global climate from your perspective?
I'm sorry, you did ask me to go first, right? Oh, no, sorry, Lydia, I couldn't hear the name. Go ahead, please.
Yeah, Linda Way, yeah.
Sorry.
You're on deck soon, yeah.
Okay, thank you very much. I think for me, and from the perspective of HITA, what we've seen in our space as most promising and prominent innovation is that of, bringing in the private sector into a space that has traditionally been a very government and donor-funded focused sector. And that is important mainly because it brings in new ideas, innovations from the technology perspective, but also, from financing options. Private sector is able to mobilize cheaper forms of financing and more, varied types of financing. So from our perspective, I think that has been, quite an innovation and quite a shift, and also opened up, your traditional forms of funding like your PEPFAR to look into not only funding your traditional, health related type of interventions like HIV, but also to looking into then bringing in some of that funding to support electrification and telecom. So I think for us, that has been, one of the key and most promising innovations that we've seen in the space. Thank you.
Thank you. Thank you so much, Linda Way. Sean, can I ask you your thoughts on promising innovations for the future?
Yeah, from a nutrition perspective, 3 of the things I presented on that continuum of services have some really exciting innovations behind them. So starting with prenatal vitamins, it's still standard of care in most countries for just iron folic acid. I think the evidence that mothers are deficient in multiple vitamins and the evidence of just how far superior the impacts are of multivitamins. So basically what we the standard of care of the US should be the standard of care everywhere in the world. And then moving into children's diets, where again, we struggled really of how do we actually get kids the nutrients they need in addition to breast milk during that 6 to 23-month age period. And these supplements, small quantity lipid-based nutrient supplements, are really quite miraculous in terms of reducing iron deficiency anemia, reducing stunting, reducing wasting, reducing cognitive delays, and in that age group, reducing all-cause mortality by 27%. So in those populations where really there are high rates of malnutrition, a huge leg up to families to help nourish their kids during that period. And then when we look at treatment of acute malnutrition, there are just this whole series of different innovations, which to me are really positioning us to realize the true potential of treatment of acute malnutrition and really bringing in the community and the early. So we get these services much closer to the community and get kids on treatment much earlier, which is good for everyone, right? It's less devastating for those kids, it's less costly to the health service, and is more likely to result in outcomes that don't have those kids relapsing. But then more structurally, I think, and some would not call this an innovation, but I think it's perhaps one of the most important shifts in global health programming is to really take seriously community health workers. And I'm on a campaign to have them rebranded as community health heroes. I think that, and particularly in nutrition, but not just in nutrition, they have the ability to deliver each and every one of these life-saving nutrition actions. And they are absolutely the most resilient part of the health system, no matter what crisis. Again, I'm very struck sitting here in Burkina Faso, where, for example, despite the number of security incidents across the country, many of the health facilities have had to close. Working hand in hand with the government and tens of thousands of community health workers, we've been able to maintain coverage of life-saving vitamin A supplementation above 90% for year on year. And that's just one case. And be it through any crisis, like having recently visited Nepal, where female community health volunteers have been the absolute backbone of delivery of services. In every crisis, they are the first ones, the most respected and the most called upon. And then I was reflecting, I really appreciated the comment made by Javiera about this, what intergenerational connections. And I think as I was thinking about my comments on the community health heroes, how many of them are older people who are paying back their community and just so deeply respected. In fact, that is the community solidarity that I think we want to continue to support and embrace. So thanks so much.
Thank you kindly for those thoughts. And yes, we agree that for the heroes. Javier, what are the future considerations for HelpAge International in terms of innovations?
Yeah, I think we are working on age-friendly cities and communities concept as well. And I think from a climate change perspective, the nature-based solutions, so connecting biodiversity and climate change connections more closely and bring those discussions and how we can, which has a lot of co-benefits in terms of health and well-being. As well, but at the same time, you will have more cleaner air, water, and a general sense of social cohesion in the communities as well. So I think nature-based solution for me is could be a game changer if it applied at a scale that all the cities and the communities can start owning that as part of their different projects and programs. I think one thing else, I think which my co-panelists also alluded to and gave an excellent presentation about the renewable energy. I think it's really a ray of hope for the off-grid basic health units, which are a lot in low and middle income countries. So renewable energy is in fact a positive sign. And just last point on the private sector investment, I think would be fantastic to have a lot of upfront capital investment in making the health infrastructure more resilient as well, because at times of disastrous climate-induced climate catastrophes, the access to health unit becomes really difficult. With the floods of Libya, you can imagine how people could access the health units. I can't imagine that. So I think maybe more investment in private sector role should be enhanced in that direction. And thanks, Sean, for alluding the intergenerational thing. And look forward to have more bilateral conversation on that.
Yeah, thank you, Javier. I'm going to turn over to Anne now to kind of round this out. It's amazing, isn't it, that it was such a diverse panel, and yet there are some very clear connection points. It's just astounding. Anne, what does the future look like to you?
So I think for the future, we have to continue to innovate on how we message our health and climate change with not just in the communities we serve, but globally. So when there's a focus on the desired health or well-being outcomes, and programs lead with this, with messaging that's relevant for that local context, there's clear evidence that you get better outcomes. So this actually may mean that we don't highlight climate change or even health, even if they're a leading factor. So let me give you an example from Relief International. We have a fuel efficient stoves program. It started with funding on the health impacts. I think I don't have to explain to this audience, indoor air pollution and all that, that creates problems for the cook and children. It also can be very fuel inefficient and contribute to greenhouse gases. But in the local context of where we work in Africa, this is not what the cooks wanted to hear about. Instead, they wanted to know that the stove cooked their meals faster and it would save them money. So in the local context, we emphasize time and money benefits in the messaging, and that's led to adoption of 2.5 million fuel efficient stoves with safer cooking. We monitor the health and emissions impacts and report those out to donors, but we had to fight tooth and nail with the donors and saying, the cooks didn't want to hear that them creating a meal for their family was potentially going to get them sick. That was not the messaging they wanted to hear. And the final point I want to make is also on messaging is that we have to strive to provide actionable steps at the local level while continuing to advocate for larger and more structural policy changes around health and climate change. But so, for example, beat the heat campaigns are things that we can do, or how to avoid drowning in a flood. We can do that immediately. but I'm very concerned that well-intentioned coverage on climate change and all that is causing, the impacts it's causing is causing too many people, governments, and even the private sector to feel non-empowered to act, and causing them to wait in some cases on climate justice or some other big policy move. We need to understand now the context specific climate change impacts and plan with the communities and take action. So I'm hoping that as we share, and we all do it, I do it as well, the big impacts, that we focus on things we can do today and really advocate for those, and don't let the bigger policy and structural things distract from those actionable things that we need to take. So thank you very much. So
Thank you, Anne. And again, thank you to all the panelists for each provoking a very robust and thought-provoking discussion to advance our understanding through this special conversation on climate and global health equity at the height of UNG UNGA Week. I would like now to ask Lisa Hilmy, the Executive Director of Core Group, for your closing thoughts. Lisa, the floor is yours.
Yeah, thanks so much, Julie, and thank you to all the panelists. Really exciting conversation, especially for this week. I'd like to ask all of the attendees, all the participants on this call. So Core Group as a convener has the liberty and sort of creativity and power to organize what we think is relevant. So I'd love to hear from you in the chat box. What is it that you want? Do you want a convening with political leaders and donors to share your thoughts? Do you want more technical sessions where there can be cross-learning? Are there workshops that you want on the nitty-gritty skills? Put it in the chat box so that, and there'll be a survey that goes out later, but we really want to inform our next steps to match what the community wants. So that's the first thing. Julie, thanks so much for your leadership and organization and moderation of this event. Kate, Lydia, thank you very much. And, you know, our incredible guests, Javiera and Sean and Lindawe, thank you so much. I think you brought some great different perspectives on the overarching, but also the specific aspects of climate and health. There's a couple things that really stand out to me. First of all, I want to go to something Sean said in the beginning about the most immediate risk for mortality and death will be and effects of climate change will be the nutrition aspect, whether it be on young children, babies, mothers, or the elderly. And so when we're thinking about these, what we can do next and the action, as well as some of the collaboration across all of us, I want us to keep that in mind. For our political leadership, we've heard time and time again here at UNGA that we need political leadership, we need investment, but we also need to mobilize on what will cause the most immediate mortality and death. There was a statement by a young activist from World Vision, a child that came from South Sudan, who was sharing her perspective, as well as one of the ministers from South Sudan. And she had spoken to a mother, and the mother said, and this really affected me internally. The mother said that she would rather commit suicide than tell her kids she doesn't have another meal for them. And so when we think about this, and not only young, but also the elderly, how it ties into all of what we've talked about, the need for us to push the agenda, to collaborate, and also integrate our programs. How are intergenerational concepts and approaches being used in all of your programs and all of the people on this call today? I think that we need to look seriously at this in order for bigger impact. And I think first at mind, immunization. We talk about a lot immunization and nutrition interventions, but how can we really make sure that they go side to side, hand in hand? the next is really making a conscious and strategic outreach for different partners. Even as we heard from Lindewa and Caterpillar, you know, as a partner, as some of the private sector, to, you know, our usual investors of Gates Foundation or USAID or bilaterals, who are the other partners we're not thinking about that can be brought into these conversations? And whether that's a convening or whether you're all doing it in your work on a daily basis, I think we have to involve more partners, different partners, to move things ahead. And then lastly, I'll go back again, global health workforce. There has been a huge movement here at UNGA with the UHC agenda, as well as pandemic preparedness, that the global health workforce, community health workers or heroes, which are mostly women, they need to be paid, they have to have capacity, and they have to be in a safe environment. And so in all of our programs, how are we making sure that we are pushing that agenda, making sure that the advocacy, but also it's included in budgetary aspects of our program, and we're involving them in the conversation, community-led, community decision-making, and the community health heroes. I'm really thankful to all of you and your expertise. It's my honor to know all of you and really hear about your great work. And so I thank you very much. And I look forward to continuing this dialogue. And again, encourage you to put in the chat box what you want more of. So thank you very much. Have a great rest of the week at UNGA, and there's a lot more to come. Thank you. And shall we do a picture also? Kate, do you want to do a picture with all of the presenters? And Julie, and can we fit everybody through a certain Zoom, a Zoom collab, you know, something on the back end? Kate or Lydia?
Yes.
Okay. And include yourselves too.
All right, I think it should be done. Okay.
Some wonderful thoughts too, that Lisa, from your closing. And thank you all to the panelists. It was just such a delight to work with you, and I really enjoyed the cross sectionality and the intergenerational aspects. Just lovely from coming. Thank you all so much for being so wonderful.
Thank you.
Great rest of the week, everyone.
Okay.
All right.
Thanks.
Thank you.
Thank you. Enjoy
Thanks,
the rest
everyone.
of the week, Lisa.
Yeah.
Great to see
Bye.
you online.
Bye.
Thanks, bye.
Bye. Thank you, Linda Way. Lovely, lovely, lovely to meet you, and
Thank you.
Javier and Dr. Baker. Wow,
you.
this has just been great. Thank you for your
Thank you.
time.
Thank you very much.
I will
Thank you.
follow up with the